Go.
Okay, hello, my name's Graham. I've had a PLIF at 2 levels in my lower back 1 year ago, and I'm now able to sit. I've had back problems for 11 years, several surgical interventions starting with discectomy at L5. I've seen physiotherapists, chiropractors, had a pain consultant, been to have laser surgery, 2 laser surgery interventions, all of which helped a little, but nothing helped me to be able to sit down again.
And you couldn't sit. How much time could you sit before we treated you?
I could sit for 15 to 20 minutes at the maximum before my left leg pain became...
And what are the other things you couldn't do? For example, you couldn't go to the gym or walk much.
That's right. Walking was restricted. I could walk maybe a mile or 2, but the big problem was sitting, because without sitting it meant I couldn't drive, and I used to drive for my job. I couldn't take part in any kind of social functions. I couldn't sit in a pub, I couldn't have a meal out with friends, I couldn't go to the theatre or the cinema. All these things were denied. I used to feel an outsider at work in meetings. I used to have to stand up and make excuses and explain why I couldn't sit down.
And everyone looked at you a little bit funnily, I'm sure.
That's right. And my first meeting with the spinal support group at Stockton, at York, was the first meeting I went to, meant that I had to stand up at the back. And there was always a feeling that I was an outsider to whatever was going on. I was an outsider to it. So initially I was rather sceptical at all these people standing up and saying how they could do wonderful things. They could go cycling in the Alps, they could do skydiving after Mr. Krishna's surgery. And I thought, well, nobody else has been able to help me, but I'll have a word with this guy. And I've never looked back. Here I am, able to sit now for as long as I want. I mean, you can sit for 2 hours without pain. It's been a long haul from surgery to getting to this point.
And you worked hard at your exercise and rehabilitation and all that.
I did, yes. I saw physiotherapists and followed their advice. It's a long, slow road from a fairly traumatic surgical intervention, I would say to people. I would certainly say this to the people who are a week on or 2 weeks on. The best advice, one of the best pieces of advice I got from a physiotherapist was I can put this in context, I've been keeping a pain diary for years, and I was used to looking at how I was every single day and recording it and so on. And she said to me, it's important post PLIF surgery to look at how you are month by month.
Right.
Look at how you are after 3 months, compare it to how you are at 6 months, but don't get bogged down in saying, oh, I'm a little bit worse today, I don't think the surgery's worked. Give it time. Your body's had a severe trauma and it will take time to readjust. In my case, discs were removed and, if you like, put back in their original position, as I understand it as a layman, that the vertebrae were forced apart.
That's right. And of course, in your case, it was revision surgery, because you'd had many previous interventions in your back,
right.
So your recovery is going to be a little bit slower than others.
Yeah.
But now you said you can go back to the gym, and
that's right. I can go back to the gym. I'm swimming again. Can't do quite as much breaststroke as I would like, but that's coming on. And I understand for back patients that's always a difficult one, the breaststroke. But otherwise, I'm as active as I want to be. I can walk. I've walked here today, 1 hour and 20 minutes. I feel better than I've done for years. It's great to be free of that grey pain spoiling every day.
And also, I think the rest of us take ordinary aspects of life for granted.
Mm-hmm.
Sitting, for example, is something everyone takes for granted.
That's right.
But when you can't sit, that's when you really realize how your life comes apart.
Yes, very much so. As I said earlier, so missing out on social functions, not being able to go out and see friends and sit in a pub, do the normal things that keep us involved with other people.
Yes.
All that stops if you can't sit.
Thanks very much.
Okay.
Thank you.